Okay, so hi, I'm Megan,
And I'm Lindsay.
and our topic for this week is successful multidisciplinary team collaboration. So we'll get right into it. So the objectives for this topic are to identify and understand the roles of multidisciplinary team members, and then also discuss methods for success in valuing and collaborating. So just to start off, we wanted to define what is multidisciplinary team care. So this is when healthcare professionals, a group, they're usually from different specialties, work together to deliver comprehensive care to a patient and really enhance the patient care experience. So they each have their unique roles that they bring to the team. And then we'll talk about this as we go on through our presentation as well. But there's various benefits that come from this multidisciplinary team approach. And just some of those that we listed here are improved health outcomes for patients, enhanced satisfaction as well for patients and their families, improved communication between specialties and team members within the healthcare setting, efficient use of resources, and then even enhanced job satisfaction for those who are serving on the multidisciplinary team. So we're going to start by sharing this clip that is, what is multidisciplinary care?
Micah has asthma. In many cases, including Micah's, asthma is considered a complex condition. It affects his lungs, but it also causes inflammation, so it affects his immune system too. That means Micah will need to see an expert who specializes in the lungs, and another one who specializes in the immune system. Micah might also need to see a respiratory therapist to help with diagnostic testing and long-term management, an asthma counselor to help determine what's triggering the asthma, and because asthma is often related to food allergies, maybe even a dietitian. That's up to 5 pediatric specialists for one condition. It used to be that Micah's parents would have to make 5 separate appointments, sometimes on separate days, to see all those specialists. That means his mom or dad was taking off work up to 5 times. And Micah was out of school up to 5 times. That's 5 times where they went to the hospital, parked, checked in, checked out, and drove home. Children's Hospital Colorado does things a little differently. We take those 5 appointments and put them all in one place. Kids see all the specialists they need at one appointment. And specialists collaborate to address each patient's needs. This is called multidisciplinary care, and we apply it to hundreds of conditions. Our specialists, nurses, and many others work as a team to address the individual needs of each child we treat. And while our specialists may be experts in their disciplines, the expert on your child is you. Here, we put families at the center of every multidisciplinary team. We are starting to redesign our spaces for this purpose. For example, our 24,000 square foot multidisciplinary space has supersized exam rooms that accommodate multiple specialists, conference rooms where they can discuss cases, and playrooms for keeping antsy kids occupied. This space allows us to spend more time with each family and more time with each other, so we can collaborate on the best way to treat kids like Micah. Multidisciplinary care is cost and time efficient. It's safer and more effective, and it leads to better communication. Most importantly, it means happier parents and kids. For more information, visit us online.
Okay, so this is a great video example of multidisciplinary care. And this particular video was from an outpatient setting, but it's applicable to an inpatient setting as well. But there are various things that really stand out. The first is how centered this type of care is on the patient, right? Like I said, it gives the patient and their family more time with providers. They're in one central location. And so it's really in the patient's best interest, right? That all these providers are working together and they have that space and ability to collaborate and work together. And so that really is what multidisciplinary care is all about. And in this case, he has asthma, right, which is more complex, right? And so that's when multidisciplinary care really is the most beneficial, is for these more complex diseases that do require the different specialties and the different team members to be involved with one another to provide this more efficient and more effective care. So here we show the various team members that could be on a multidisciplinary team. And as you see, there's a lot listed. I think some of the most key in relating to us going into child life are child life specialists and the child life specialist peers that may work with you in the healthcare setting, and then the patient and the patient family and their guardian, right? And the video said, right, they know the patient's parents or guardians know the patient best, and obviously older patients as well. It's very important, right, once they can learn to communicate, that they are part of this decision-making process as well. And so here you see as well advanced practice providers, includes doctors, PAs, NPs, nurses, social workers, different therapists. There's a lot of different possibilities of who can be on a multidisciplinary team. And it really does just depend on the case and the patient and who is most needed to effectively help the patient.
So the role of a CCLS on a multiple disciplinary team can just be described from the ACLP as one of the essential goals are as the follows: to communicate and advocate effectively with other members of the healthcare team. And CCLSs also need to collaborate and participate in those multiple disciplinary team meetings, as well as communicate their child life plan of care specifically for that patient. They also need to educate every team member on the developmental needs of children, families, and their support system, because as we know, it is a case-by-case basis. And CCLSs also need to adhere to healthcare policies and procedures related to verbal as well as written documentation per the ACLP requirements. On the next couple of slides, I'm actually going to be talking about a specific chapter in the Child Life Handbook by Thompson, specifically the chapter relating to communication. Starting off, human communication is extremely complex. It is dynamic, ongoing, and it is constantly changing interaction between different individuals. And communication is extremely important, specifically in the CCLS field, because as CCLSs, we won't only just communicate with patients, but with their family members, as well as a huge majority of other staff members that Megan previously had stated in previous slides. Communication is a transactional activity, and participants actually influence one another to a great deal. And those influences can be verbal as well as nonverbal. I also wanted to point out the importance of context with communication, and context refers to the place where that communication is occurring. And depending on the context, there could be certain levels of distractions. And it's important when communicating to recognize and even adapt to those distractions. So in a hospital, as a CCLS, we're often communicating and talking to children in the hospital. And because of that hospital context, there could be a lot of distractions like beeping noises, voices on the intercom, things like that. So it's very important to keep those things in mind when we are trying to communicate with those kids. Next, I wanted to mention is some verbal communication possible issues that could arise specifically in a hospital or medical setting. One of the big ones is medical jargon, which is short phrases, acronyms, things like that, that are typically used between medical staff. And now for medical staff, those medical jargons actually promotes clarity, and it can save time between those medical individuals working or providing for a specific patient. But medical jargon to children and family can actually come across as intimidating and frightening. So as CCLSs, it is important to become a translator for medical staff and those children and their families. So as a way to help eliminate those fears and provide some clarification with those medical terms and acronyms. Next up, I wanted to hit on some nonverbal communication. And a lot of the nonverbal communication, it's just seen on individuals. So things like physical appearance, clothing, makeup, hair, it all says something about you, and people can translate that differently. Facial expressions are a big one. And the main facial expressions that can be seen on people are usually fear, disgust, anger, surprise, sadness, and happiness. Gaze is really important. Gaze is referring to the use of eyes to communicate to individuals when communicating. And those can be, gaze can be non-reciprocal, a mutual gaze, gaze aversion, or unwanted staring. The next one is gesture, which are just movements and cues from our body that communicate a certain desire or yes or no things. So those are things like head shakes, like yes or no, thumbs up, meaning everything's okay, covering your mouth when you are shocked or surprised, to name a few. The next one is voice, which is the change in your focal emphasis. And that actually regulates the flow of conversation between individuals or groups. And voice covers a lot, everything from the rate of voice, your tone, volume, pitch, and rhythm. And I really wanted to point out the picture on this slide that actions speak louder than words. So yeah.
I wanted to add as well, I think we covered this a few weeks ago, right? Emotional regulation. This is such a big part of communication, right? So when we ourselves can regulate our emotions, that will obviously, whether we can or can't regulate our emotions, will impact our ability to portray that verbal or nonverbal communication with patients and with other members of a multidisciplinary team.
And on this slide, I wanted to briefly talk about effective listening. And with this, just listening in general, it doesn't only make it possible for us to understand others, but it also makes it possible for us to be understood ourselves. And the book really highlighted the importance that listeners actually have more power in communication than the speakers, because when it comes down to it, listeners have the authority, the power to decide if they are going to listen or not. And I really like this chart on the side about active listening, and just to highlight a couple of them. Active listening involves empathetic being, summarizing or paraphrasing what that person was trying to communicate to you to make sure you do have a understanding of what they were trying to communicate to you. Asking questions, as well as just self-awareness of what your own body language is doing and how you're responding to them communicating with you, as well as observing their body language along with their communication and verbal communication. So things like that, very important, and active listening. And I do want to point out that like all this communication, it's verbal and nonverbal things that are happening, things that are being said, things that you're seeing. So very important to make sure when you are communicating either with staff members or family members to keep all of these items in mind. So one of the articles we found was workplace relationships and professional burnout, specifically among child life specialists. And this research was actually done last year in 2021. The main finding was that positive supervisor, peer child life specialist, and medical coworker relationships are associated with lower levels of burnout among child life specialists. And essentially that means that they had lower levels of emotional exhaustion. And they found that the strongest association of lower levels of burnout was due to high quality relationship with one's direct supervisor, regardless if they were specifically a CCLS or a non-CCLS. The research found that the years of experience, age, exposure to chronic illness or terminal illness and trauma were actually not significant predictors of burnout. The research also identified that CCLSs actually reported that burnout was the cause from emotional burden of just the CCLS profession in general, as well as a lack of compensation with a large workload and the lack of respect or understanding of CCLSs by other hospital staff. The article's implications and recommendations are as follows. They recommended additional training for CCLSs as well as for their supervisors, and that training should involve advocacy for the child life profession to other medical team members as well as to administrative boards, and to educate on role boundaries and support for maintaining a healthy work-life balance for CCLSs just in general.
I wanted to point out as well that we included this chapter on communication from the Child Life Handbook and this article specifically just because they really do come back to that communication aspect, right? The advocacy for the child life profession requires communication, right, with other healthcare professionals, and just the ability to create those relationships is really, I think, such a key aspect to having successful multidisciplinary teams. So now I want to talk about another article and report that we found that was very, very interesting about improving communication between child life services and then nursing, specifically in this inpatient pediatric unit at the Barbara Bush Children's Hospital. So they created this poster about what they did specifically in their unit to create this multidisciplinary team and to have that level of collaboration, right? I think that's such a key word when it comes to multidisciplinary team is collaboration. And just as I was looking up the definition and more about that word specifically, right, it talks about working with others towards the same mission or purpose. And so at this children's hospital, the nursing team and the child life team began to notice that there was confusion and misunderstanding among patients just regarding their care and recovery, and that they needed to improve that. And so as they researched and tried to decide what really was the key factor in that confusion, they attributed that to the lack of collaboration and communication between the child life and nursing teams. And so here on this slide, I included just part of their poster with the problem that I just stated, their scope, and then their goals and objectives. They had 5 goals and objectives, which was to, number 1, 100% of the time, child life would be notified prior to an IV start. And this was one of the measures that they chose, one of their goals, just because it was a common procedure that almost every patient would undergo. And then they also said the child life specialist will have a formal referral process. The child life specialist would start to round every morning with the nursing staff just to kind of know what procedures were planned and any needs that the nursing staff anticipated for that day. And then I think this is a really important one as well. 100% of the nurses would be educated to the roles, services, responsibilities of a child life specialist. And then the last one, they'll collaborate, right? They'll do all those things to work together. And so here in this little chart down here at the bottom, we can see for this survey that patients and their families were given on how well did your child's nurse explain things to your child. They were not doing great in 2016 compared to the national average. And here they have the percentage of times that a child life specialist was notified for an IV start, which was 71%. But then interestingly, it says that there was no kind of meeting or huddle or collaboration between the two teams of child life and nursing. So it's just kind of like they called them and that was it, right? They did their job and then they left. There's no communication, right? So they saw this as a problem. So here, just like I said, they kind of pinpointed why that was. Why was there that lack of communication and collaboration? Says the nurses often didn't call. They didn't think a child life specialist was needed. I think this is a big one. They were unaware of the scope and practice of a child life specialist. And the child life specialist worked independently from the nurses, and a lack of structure within the child life program. So they came down to the root cause, which was no formal leadership in the child life program, and that lack of education with the nurses. So they came up with some measures, countermeasures of what they could do to combat this issue in their unit. So a child life program manager was hired. They had more contact information for the child life specialists. They really focused on making sure they were called for IV starts, and they had morning check-ins. I think this is such a, like I said, something big with communication and collaboration is that every day a child life specialist would check in with the nurses, review the care plans, and everything. It says on 100% of all patients. And then continue brainstorming and moving forward. So if you look at the dates, this whole study and report occurred over just a little under 2 years. And if we look at their outcomes, you can see drastically in 2018 on the survey, how well did your nurse explain things to your child? It went up. There was lots of great feedback about the child life specialists and how helpful they were in the process as well. And then August 2018, 100% of the time that there was an IV start, a child life specialist was called and included in the procedure. And so then they even went on to create next steps because they wanted to implement this more into their hospital setting in the other units as well. So they wanted to continue that expansion throughout the hospital, sustain and enhance the collaboration that they did have already. The child life specialist would continue to be notified for sedations and other procedures. The emergency department child life specialist available for night calls, right? So they have the whole list of things that they wanted to continue. So I think this is such a great example of how something small in this inpatient pediatric unit, there was no communication, no collaboration. They noticed the need to change that. And the change and the formation of this multidisciplinary team in this unit helped propel the importance and the work of multidisciplinary teams throughout the hospital and other units as well. And so here to talk about the methods for success in valuing and collaboration. So these are some of the things that are necessary to have successful multidisciplinary teams. Respect and trust between team members. Obviously, I think that comes with communication and getting to know them and recognizing that they have their own specialties and knowledge, right? And that they have things that they can do to be useful to the patient experience as well. And then agreed methods for communication and interaction, right? So really establishing this is when we will meet, this is how we will communicate, this is how frequently we'll communicate among all the team members, I think is very important. Educate of your role and value as a child life specialist, right? We talked about this a little bit earlier as well. I think there's always room to establish and teach more of how we can serve as child life specialists and how especially our role can be valuable within this multidisciplinary team setting when looking at the patient's overall picture and health. Make time and be accessible, right? We need to be sure that we as child life specialists are available for these other team members to communicate with us, to check in, to ask questions. I think that kind of helps establish that respect and trust. And then understand, as I mentioned before, the responsibilities and value of each team member. And then just this last one, be open and have the desire to learn, right? Ask questions. That's a big part of the communication that Lindsay talked about, is getting to know those that you're working with. And I think the more open you are with one another, it really will help enhance the patient experience as well. And then to end, we wanted to share this quote from the Association of the Child Life Professionals. Certified child life specialists, frontline members of multidisciplinary care teams, create and maintain an experience and culture within pediatric healthcare that others cannot. So we'll talk about this a little more in our discussion, but we loved this quote just because really as child life specialists, we do have the opportunity to enhance these multidisciplinary teams, right? And create and maintain an experience, right, that others cannot. We have unique skills and knowledge that really are so beneficial, and in collaboration with these other healthcare professionals, can really help enhance that patient care experience. And even in the other articles we read, enhance overall job satisfaction for us and for those that we're working with. So that's all we have here. So thank you for watching. We have our references listed here at the end, and we look forward to talking with all of you in the discussion as well.
Thanks.